Hi, everyone. Today I want to talk about something most men over 60 think about, but rarely ask their doctor. I'm Dr. Sarah, a urologist who's spent years helping men stay healthy, confident, and informed, even after 60. Now, here's the truth. Yes, masturbation can still be safe and even beneficial for your health, but only if you understand how your body changes as you age. Most men don't realize that the same habits that worked in their 30s might actually cause pain, irritation, or even heart related issues later in life. And here's the part nobody tells you: it's not just about physical safety, it's about circulation, hormones, and emotional well being. In fact, there are three common mistakes older men make that can quietly harm their sexual health, and one of them might surprise you. So before you scroll away, stay with me, because by the end of this video, you'll know exactly how to keep things safe, healthy, and enjoyable without crossing any risky lines. Let's start with what really happens to a man's body after 60. You know, a lot of men tell me, "Doc, I still feel young up here," and that's great. But the body? It changes in quiet ways most of us never notice. After 60, your body's natural rhythm starts to slow down, not to stop you, but to remind you to move with it. For example, testosterone, the hormone that fuels desire, muscle strength, and energy, tends to drop by about 1% a year after your 40s. It doesn't disappear, but it does mean your body reacts differently to arousal and stimulation. You might need more time to warm up, and that's perfectly normal. Another big shift happens in your blood vessels. The same arteries that feed your heart also feed the blood flow that allows for an erection. As we age, those vessels can get a little stiffer, a little less responsive. So when men say it's not as strong as before, it's often more about circulation than anything else. In fact, urologists often call erectile changes the check engine light of the cardiovascular system, not a problem to be ashamed of, but a sign to check how your heart is doing. Nerve sensitivity can also change with age. Some men notice they need more stimulation. Others, the opposite. Things feel too sensitive or even uncomfortable. This happens because the pelvic nerves that control sensation and blood flow may not fire as efficiently as they once did. Again, this isn't failure. It's physiology. And finally, there's the mental side. Stress, medication, sleep, and even loneliness can all affect how the brain responds to pleasure. Your brain is the biggest sexual organ you have, and at 60, mental and emotional health matter just as much as physical health. So when we talk about safe self-stimulation, we're really talking about working with your body, not against it. Because understanding these changes helps you avoid pain, strain, or frustration, and instead, turn it into a form of healthy self-care. Now that you know what's happening inside your body, let's talk about how to do it safely and the three common mistakes most men over 60 make without realizing it. Now that we understand how the body changes after 60, let's talk about how to stay safe, because the goal isn't to stop, it's to do it smarter. Most men think they already know what they're doing, but I can tell you as a urologist, there are three common mistakes I see all the time that can quietly cause problems over the years. Let's start with the first one, the dry friction myth. Many older men skip lubrication, thinking it's unnecessary or even unnatural. But here's the truth: as we age, the skin becomes thinner, more delicate, and slower to heal. Friction without any kind of lubricant can lead to irritation, small cuts, or even mild infections. The safest option is a water-based lubricant, easy to clean, gentle on the skin, and compatible with most skin types. Avoid using household products like oils or lotions. They can clog pores and cause irritation. Remember, comfort is key to safety. The second mistake? Ignoring the heart connection. Your sexual health and your cardiovascular health are deeply linked. The same arteries that send blood to the penis also supply the heart and brain. So, if you find yourself getting short of breath, dizzy, or experiencing chest tightness during arousal, that's not something to ignore. It doesn't mean you need to panic, but it's a good reason to talk to your doctor. Sometimes, these signs point to circulation issues that can be improved with lifestyle changes or medical guidance. And the third mistake, treating it like a performance test instead of self-care. At 60 or beyond, pleasure shouldn't feel like pressure. chasing the same results you had at 30 can actually lead to frustration or even nerve fatigue. Instead, focus on relaxation, deep breathing, mindfulness, and exploring what feels good now, not what used to. Your body's feedback is the best guide you have. Safe self-stimulation is not about doing more. It's about doing it with awareness. Use gentle rhythm, rest when needed, and make it part of your wellness routine, just like walking or stretching. Up next, we'll talk about something many men avoid when it's time to see a urologist and what signs you should never ignore. Now, here's something many men don't like to talk about when it's time to see a urologist. I get it. For a lot of men, especially after 60, that conversation feels uncomfortable or even embarrassing. But here's the thing, seeing a urologist isn't about something being wrong. It's about making sure everything is still working safely and catching small issues before they turn into bigger ones. So, when should you check in? Let's go through a few clear signs your body might be asking for help. First, pain or swelling after masturbation or sexual activity. A little sensitivity is normal, but if you experience ongoing pain, burning, or swelling, it could mean there's inflammation or irritation that needs medical attention. Second, blood in your urine or semen. This doesn't automatically mean something serious, but it's worth getting checked. Sometimes it can be linked to prostate inflammation, small vessel fragility, or even mild infections. Early evaluation can rule out more serious conditions. Third, erections that last too long or feel painful. If you experience an erection lasting several hours without stimulation, that's called priapism, and it's a signal to seek care immediately. It's rare, but at this age, certain medications or circulation changes can make it more likely. Fourth, numbness or loss of sensitivity. This can sometimes be caused by nerve compression in the lower back or pelvis, and it's not just a sexual issue, it's a neurological one. The sooner it's addressed, the better the recovery. And lastly, if your desire has dropped suddenly or your performance anxiety feels overwhelming, it's okay to talk about it. Hormonal changes, stress, or medication side effects can all play a part. A urologist can help you figure out which one without judgment. The truth is, men's sexual health is part of men's overall health. Seeing a urologist doesn't make you weak, it makes you smart. Because taking care of this part of your body means you're taking care of your heart, your hormones, and your confidence too. Coming up next, let's wrap this all together. How to keep your sexual health strong, safe, and enjoyable after 60. So, here's the takeaway: after 60, your sexual health is still an important part of your overall well-being. It's not about chasing youth or comparing yourself to how things used to be. It's about understanding your body, respecting its changes, and keeping both your mind and your circulation healthy. Safe self-stimulation can be a normal and healthy way to maintain blood flow, reduce stress, and connect with your body, as long as you do it with awareness. Listen to your signals, use protection and comfort in mind, and never hesitate to ask your doctor questions. That's what real confidence looks like, staying informed, not avoiding the topic. If this video helped you understand your body a little better, share it with someone who might need it too. And let me know in the comments what questions you'd like me to answer in the next episode, maybe about natural ways to boost libido safely after 60, or how lifestyle changes can support sexual wellness. Because remember, your health journey doesn't end at 60, it evolves. Stay tuned for the next video, where we'll talk about simple, science-backed habits that can naturally support men's sexual health after 60.